Thank you. That was a great overview summary. This has been a wonderful session or workshop, and I'm looking forward to the session today. This is going to be session 4, real-world applications, and I'd like to introduce our first speaker, who is Aryeh Stein. Dr. Stein is a professor in the Department of Global Health of the Rollins School of Public Health at Emory University. In his research, Dr. Stein utilizes critical periods of susceptibility to nutritional deficits in studying the role of nutrition over the life course on the development of chronic disease. His presentation today will address early exposure events and obesity-related outcomes. Dr. Stein?
Good morning, everybody, and thank you so much for the workshop organizers for the invitation to be here. I'm sorry that I could not be here yesterday. One of our students was defending a doctoral dissertation. So the brief that I was given was to review the current literature on prenatal exposures to famine and food shortages and their effects on adult body weight and obesity risk. Some of you may be aware of a paper that I co-authored with Dr. Bertie LeMay of Columbia a few years ago. So we've used that as our starting point for today's presentation. And my research assistant, Bernice Thomas, supplemented that with a PubMed search. We kind of screened a bunch of papers, focused on the human ones, and found a total of 11 studies that pertain to this particular topic. I'm not going to do a formal meta-analysis of 11 studies. I'm going to review some of the central themes. There are, to my knowledge, three famines that have been addressed in the literature. One is the Second World War. Another is China, and the third is Biafra. Starting with the Second World War, the most famous episode is the Dutch Hunger Winter, a 5-month period of food shortages in the last winter, the winter 1944-45. This has been recognized for a very long time as a great period to study short-term effects of famine and hunger, food deprivation on the next generation. The first study to look at that was Gianpaolo Rovelli's paper in the New England Journal in 1976. This was a study that looked at the medical examination data of 19-year-old males who are in Holland at the time and probably still has national conscription. And this paper showed that if you order these young men by whether or not they were born in an area subject to the famine, in other words, the urban areas of Western Holland, or born in a non-famine area, the kind of, not sure that this is kind of the green line, right, which is births outside of that area, that if you're on the blue line here, there are two periods which differ from the green line statistically. One is the A2B1 cohort, which are individuals who were exposed very late in gestation and for whom there is a lower risk of obesity as defined by these authors. And the B1, B2 period, which is middle and early gestation exposure, in which there is an increased prevalence of obesity at age 19. I'd like to point out that, yes, this is a doubling of the prevalence of obesity. It goes from about 1% to about 1.9%. This particular measure of obesity is the 120% above the Metropolitan Life Standard, which is what was used at the time. Bertie LeMay has access to these original data. He's replicated this analysis. If you use this definition, the original coding was correct. But there are no differences between these groups in BMI, and there's no differences in these groups using kind of more current definitions of obesity. That was based on a retrospective cross-sectional sample at age 19. There have been two groups that have worked prospectively using birth cohort approaches. The first group, led by Anita Rovelli, who is no relation to Gianpaolo Rovelli, examined a group of men and women born in the main Amsterdam maternity hospital and followed them through to about age 50. There are roughly 740 men and women combined in this data set, of whom roughly 300 were exposed at some period to famine. The data are then stratified by early, middle, and late exposure in non-overlapping cohorts and further stratified by gender. So there are 6 cells with which to stratify these 300 exposed people. This particular paper showed that in those exposed in early gestation, but restricted to women, there's an increase of about 8 kilograms in body weight relative to the unexposed. That translates to about a 7.4% increase in BMI. There was no major differences in height, and there were no detectable differences in men. Our group independently replicated this study somewhat a few years later. This is now age 59 data. This is 3 additional institutional births, 2 maternity hospitals, and 1 midwife training school. In our data, we're restricted to roughly 350 exposed people, stratified now into 4 gestational exposures, which are partially overlapping, so the numbers don't add up to the 350, and 2 genders. We are unable to replicate that big increase in body weight in the early gestational exposure group. In our data, this is a consistent 4 kilogram increase in body weight of women exposed to famine in any period, regardless of the period, relative to the unexposed controls. In men, there is no evidence of any effect except in men exposed very early in pregnancy. And I'd like to remind you that sexual differentiation in humans occurs in the first few weeks of gestation. All right, so maybe those very early exposed men are really kind of acting like women. Leningrad was a 3-year siege, almost, okay, between 1941 and 1944. What we have here are data collected among survivors of the siege, recruited in and around Leningrad in the 1990s. They were kind of average age 52. The authors were kind of looked at whether or not these people were born during the siege, born somewhat before the siege, or were born in the areas outside of the siege area, in other words, in the German-occupied areas outside Leningrad. They were unable to identify any differences in body mass index between these 3 groups. Overall, no differences in skin fold ratios between the two exposed groups, and with a somewhat lower skin fold ratio in women in the unexposed group. Finally, a recent paper published in the Israeli Medical Association journal looking at individuals who were born in the Nazi-occupied parts of Europe during the Second World War, and therefore whose mothers could be assumed to be exposed to food restrictions and other stresses of being Jewish in German Europe. The sampling here is snowball sampling among individuals known to the Holocaust survivors organizations. The control group is data that are propensity matched from the Israeli National Health Survey equivalent. The sample size is very small. There are 70 such individuals known to be living in Israel. The number of controls is, of course, unlimited. They chose 230. What this group did identify is higher prevalence of dyslipidemia, diabetes, and hypertension. They stratified by gender. They do not report the data for females, except to say that there were no differences in BMI. And in males, there's about a 2-unit difference in BMI. This is at roughly age 70, between the 70 individuals who were born in Europe and the 230 individuals who were born in what was then Palestine. Moving on to China. China is a 2-year famine caused by a variety of political and climate, kind of, shall we say, unfortunate circumstances, to put it mildly. There have been several studies that have looked at the long-term consequences of being born during this period. Probably one of the best is by Chang Wang, who has used a variety of approaches to try and model the deficit in kind of population count attributable to the infertility during the famine by looking at how the urban areas also fared, because kind of during the famine there was mass shipment of food to the urban areas away from the rural areas, which therefore had an even worse famine than they would otherwise have had. So in this paper, he finds that individuals who were born before the famine, in fact, had higher BMIs than those born after the famine. Those born during the famine were lower. I would like to kind of just point out, right, that the famine caused maybe 50 million deaths. Most of those deaths occurred to children. We have to think through what type of children died during the famine versus those who survived and went on to become in his sample. We'll come back to the other limitations of all such data in the discussion. Right. A second paper from the China famine. I've ordered them by the age at follow-up. In this particular one, the BMI of the women was significantly higher in the 3 famine groups relative to the controls. I would point out in this paper that the controls were all born in 1964. The famine exposed were all born in 1959 through 61. What happens to people as they get older? We tend to put on weight. So you have an uncontrollable confounding by age in this particular analysis. Here another study, right? Average age about 50 now. Okay, these are kind of data recorded from annual physical examinations. I know that these charts look like the top, which is females, and the bottom, which is males, go in different directions. I'd like to point out that the scales differ across these two. Right, the male data, these are all within about a 0.3 BMI. The female data up the top has a 2-unit BMI range. So what they're noticing here is that in women, but not in men, okay, the toddler group, in other words, those who were young during the famine as opposed to those born during the famine, had an increased odds ratio for obesity at age 50, okay, and somewhat intermediate for those exposed gestationally. Nothing significant in men. One more from China, again, kind of lower odds of obesity in men exposed during what they call periods of fetal development. Finally, Biafra, as a consequence of the Nigerian Civil War in the 1970s. This is a study based on house-to-house recruitment of individuals who are roughly age 40, and then they were categorized as into their exact age and whether or not they were born during in the region at the time. What we see here is kind of essentially the unexposed being younger, again, are thinner than the exposed, with no kind of major differences between the famine in early childhood and the unexposed. The fetal infant period, which is those who were conceived and born during the famine, are somewhat, have a somewhat higher BMI. To try and address questions of selectivity and the problems that famine and during a war period is not just shortage of food, there are also social stresses. This group, based out of the Netherlands, looked at data from the Indonesian Family Life Survey to try and identify people who may have self-selected to kind of change their diets. This is as a function of Ramadan. And what this particular group did is they used these data, analyzed the data based on presumed exposure to Ramadan, based on the cycle in which Ramadan occurred during the year of birth of the individuals in the cohort, and essentially found that the exposure to Ramadan early in gestation, those people were thinner. If you were Muslim, if you were non-Muslim, there were no associations. So just to pick up on that point, that they've tried to identify people who were likely to have self-selected into fasting over Ramadan. So let's summarize briefly. Okay, there were 3 Dutch famine studies. Okay, all 3 of them suggest that at least in one group and at least in one period of gestation, there is an increased prevalence of at least one measure of overweight later in life. Okay, the early gestation tends to have stronger associations than later, right? And there are stronger associations in women than there are in men, where one is able to look at differences between women and men. The recruit study only studied men. The Chinese famine, there are 4 studies, and the results essentially are all over the place. You can make any determination you want based on the study you pick. The other food shortage studies, the Leningrad study found no major associations. The Holocaust study has serious problems of sample size and selectivity, and found a higher BMI in males, but nothing in females. The Nigeria study, there was an increased waist circumference and risk of overweight in those exposed to the famine. And Ramadan, those exposed to Ramadan in utero were thinner. So what do I conclude from that? I'm an epidemiologist, and the first thing that epidemiologists always say is the study is fundamentally flawed. And I would point out that even my study is fundamentally flawed. And the main reason for this is the first thing that happens to women if food is restricted is they become amenorrheic. So fertility drops. In Holland, fertility dropped 50% over the 3-month, 4-month period. In China, in some places, fertility dropped 60, 70%. In Leningrad, fertility dropped 80%. Okay, if fertility drops and some women are still having children, what makes those women and those children different from the women and children the children who weren't born because the women weren't fertile? So any study that compares this general population before and after to the group who conceived during the famine has a fundamental confounding problem that is, with most designs, not resolvable. I believe that our data come closest to that because we've recruited siblings of the affected birth cohort who at least have the same mother, so that is controlled for, right? But none of the other studies have been able to do that. None of the studies of the famine studies are able to separate out the effects of food shortages from the effects of everything else that's happening during a war. Holland, 1944-45, was particularly cold. Maybe it's the cold, maybe it's the food shortages. We don't know. Where there are data, it looks like the female offspring tend to be more vulnerable than the male offspring. All right, our data don't lend themselves to explanations for that, but they do tend to suggest that. And they do suggest that their risk of obesity is increased following early gestation exposure. The only place we've really been able to look at that is in Holland. The other studies, the famine is too long to well differentiate early exposure from other periods and for whole gestation exposure. But we have, and the famine is, the Dutch famine, those cohorts are, that is the universe of data that we have. I'm not going to cover it here. If you want to look at some papers that we have from the Dutch famine where we've gone into trying to explain some of those mechanisms, I'd be happy to kind of think about that in the discussion, but kind of that was not the brief for today. Thank you.